Good morning. And welcome to the Tools of the Trade. So this is one of the first ones of the new academic year, really focused on launching your biomedical research career. And the Tools of the Trade is something that the Center for Clinical and Translational Science has done over the last slightly more than a decade. And the real concept of these is, rather than having another set of seminar series, is really to try to bring together experts in different areas around a specific topic that actually give you new skills and things that you can bring back to your research groups and your laboratory in order to be more successful. One of the things that I always like to start and put in perspective is actually a quote from Gordon Gee when he was the second coming of the president of the Ohio State University. And in talking to the Board of Trustees one year, he said, as a land-grant institution, the faculty, staff, and students at Ohio State really have a mission to translate new knowledge as a sacred social compact. So as scientists, as translational scientists, clinician investigators, students and trainees, one of the things that's absolutely critical is that we think not only of how do we get depth in our own area of expertise, but how do we work collectively and able to translate that to actually improve the ultimate health and well-being of our communities, both locally, nationally, and globally. And many of you know, in fact, that this translational process is not unidirectional, but in fact is multidirectional, and that we learn from the bedside in the communities, bring it back to the laboratory to be able to address mechanisms and find new targets, and then bring those back to the clinic and then to populations in order to be able to actually have better diagnostics, better preventive strategies, and of course, better treatments. But one of the problems is that it's actually a process that's fraught with difficulty, inefficiencies, and part of those are the fact that it really requires collaborations, communication, and other things that, in fact, often as graduate students or professional students during our training, we weren't taught about. So we are very, very good at our scientific domains and the area that we work on, but in fact, it's kind of a new world in the way that we need to work together. So in fact, translational science is really team science. And when you think about it, you're going to have to work across all those disciplines, from the bench to the clinic, to the population, and with public policy in order to be able to have significant impact. And so it's really that full spectrum of scientific endeavors coming together to actually make the whole. And one of the things that's important is that we always understand where that long-term impact is, okay? What are we trying to do? What are we going to enable? What is new? What are the non-obvious, and what are the advantages of doing it? And one of the opportunities we have at The Ohio State University is, in fact, by having so many different perspectives on a single campus, that we're really able to bring those to ask questions in a way that aren't only multidisciplinary, but in fact are interdisciplinary or transdisciplinary, kind of that magic secret sauce that once in a while makes us think of things in ways that were never thought of before. And so when we talk about partnering, we've talked today about developing some of those skills and setting up your laboratory and pulling together your team and working across disciplines. It's important to recognize that it's even broader than what you probably traditionally think about of your research team, because your research team should include stakeholders, patients, physicians, other individuals who are actually going to utilize that new knowledge that you move forward. Maybe different scientists who are going to adopt some new methodologies or techniques, or take your scientific accomplishments and move them forward to the next area. So again, developing those kind of fundamental skills and teaching them to the people around you becomes critical. The next part, of course, as I said, is it really does take a team. And in bringing together that team, one of the easiest actually is that central core at defining your science, your scientific hypotheses, the things. But it's also important that we're actually incredible team leaders, that we know how to go after funding, that we know how to create a safe environment for those individuals who work in our research team, both in a very kind of small area and the people you work directly with, but in fact with your collaborators as well. It's important that you think about empowering the people that you work with so that they can take new ideas and bring things and actually do some of the most innovative science that is possible. And that you develop the communication strategies, because sometimes it's not so easy. Sometimes there's conflict that you need to resolve. For example, who's first author on a paper? Who's last author on a paper? How do you get appropriate credit among multiple individuals who are all working? And in fact, that science couldn't have moved forward if you didn't all work together. It's also important that we think about how do we do this in a way that presents high quality, safe, rigorous, and reproducible science. And so one of the things that you're going to hear about today, just after the lunch, are the types of programs that are available through the Center of Clinical and Translational Science, as well as the Clinical Trials Office, the CTMO, and the university, as really going to create that kind of integrated infrastructure that will help you be more successful. How do you work with regulatory, whether it's IACUC or IRB, in order to be able to actually efficiently move things forward in the safest, highest quality environment? How do you work together with your biostatistician from the very beginning to ask questions that actually answer important things and are impactful? Because not every question and not every study design can be done quite the way that you think about. And then lastly, we're going to talk a little bit about scientific communication. Because as Albert Einstein said, if you can't explain it simply, then you don't understand it well enough. And certainly that's a fundamental of writing your grants and continuing to get your funding. But don't only think about things that we talk about from a grant writing perspective. Think about the same things from how do you present your data at a scientific meeting to other individuals so it's meaningful, and how do you get that information out to the stakeholders, to clinicians, to public policy, and to patients in order to make it usable information. So think about some of the things that we talk about as you kind of launch your early career or move things forward as actually this journey in becoming a better clinical and translational scientist. You're going to want to develop the skills that allow you to do this. And one of those, of course, is to take your passion and really direct it at a lofty goal, at that bigger thing to actually improve human health, to identify those most pressing scientific questions, to really establish a research team where everybody's empowered to contribute and to bring new ideas together, and then to help you find mentors that are really going to help to show you what success looks like. How do you do things? How might you traverse some of the challenges that you come? And it's not one mentor. In fact, you're going to have different mentors your entire career, even to the point of the time you retire. It's important that you think about how do you demonstrate those things. So how do you look at the potential innovative solutions that are out there? And again, we're going to focus a lot on some of the breakout sessions, not only this culture of safety, which is in fact the primary reason for regulatory oversight for both animal and human research, but more importantly, or certainly equally importantly, is that critical importance of rigor and reproducibility, that we understand that it's important that we know what types of research are specific to the single thing that we're looking at, which are generalizable and actually can have a major impact. And then lastly, disseminate your knowledge. Disseminate it through your grant writing, disseminate it through talking and presenting your research to your peers, and of course, disseminate it to those people that you're trying to impact, the patients that have things. And what we hope today is that we'll just give you a few additional skills that will really help you move forward in team science. This is my favorite quote, and I always use it at the end of talks. And it's really from Henry Ford, who said that coming together is a beginning, keeping together is progress, and working together is success. And it takes a village. It takes everybody to move translational science forward, and hopefully we'll empower you just a little bit today in order to be able to do that more effectively.